Hi, my name is Joshua Harris from Houston Methodist Orthopedics and Sports Medicine, and today I'm here with my co-authors Kyle Sochacki and Bob Jack, and I'd also like to recognize our other co-authors, Matt Byrne, Dave Littner, and Pat McCullough. And we're going to talk about our recent paper in the American Journal of Sports Medicine, and we would also like to thank the journal for the opportunity to present this short video on our study. Our study was titled Performance and Return to Sport After Tommy John Surgery in Major League Baseball Position Players. Now, this is a topic of great interest to our group here in Houston. We have previously published several studies on return to sport and performance upon return to sport in not only Major League Baseball, but also in the NFL, NHL, NBA, and Major League Soccer. The issue of return to sport is of great interest for not only us as clinicians, but obviously for players, coaches, and teams. We designed and conducted this study with all publicly available data using return to sport dates, timing, and performance, and compared this to age, position, years experience, and performance matched controls. All position players, which means all non-pitchers with a minimum of 1 year follow-up, were eligible for inclusion if they underwent UCL reconstruction by any technique. Return to sport was defined as return to sport in at least one Major League Baseball game following surgery.
33 Major League Baseball position players were found to have undergone Tommy John surgery. About 85% of these players were able to return to sport at an average of 11 months. These results were similar to what has been established in the literature for MLB pitchers. Interestingly, players who were over the age of 30 at the time of surgery had significantly lower return to sport rate as compared to their under 30-year-old counterparts. There were positional differences as well, specifically in catchers whose career length was on average 3 years shorter when compared to match controls who did not undergo surgery. Lastly, about half of players who returned to sport did so at a different position, and 1/4 of players returning did so at a position that had less demand on throwing than their position did prior to surgery.
Multiple prior studies have evaluated performance and return to sport in Major League Baseball pitchers following elbow UCL reconstruction. However, there have been limited published studies on surgical outcomes in position players in Major League Baseball. Our study adds not only to the return to sport rate and the timing of return to sport, but also gives insight into performance both offensively and defensively in comparison to their pre-op performance and in comparison to match controls. It also provides an appreciation of the rate at which players have to change position in order to successfully return to sport in Major League Baseball. Given the unique demands of pitchers and non-pitchers, having this position-specific data is highly valuable for appropriate counseling with players and teams in discussions of return to sport after UCL reconstruction. Although this study has a small number of subjects, it will be impactful as it is the largest of its type in the current literature. Future studies should continue to build upon this with larger numbers of subjects and complete career follow-up, which will allow us to determine optimal surgical technique and rehab guidelines in managing this challenging injury in Major League Baseball position players.